Namaskar, I am Dr. Nilesh Chordia, surgical oncologist at SSO Cancer Hospital. Today we are talking about something many women don't talk about, something that whispers before it roars, ovarian cancer. I have treated countless women over the years, strong, resilient women who delayed seeking help because the signs were easy to miss or easy to ignore. This video isn't meant to scare you, but it is meant to empower you, because when it comes to ovarian cancer, awareness is your first line of defense. Why we miss signs? Let's begin by understanding why ovarian cancer often goes unnoticed. Because sometimes it is called silent killer. Not because it is silent, but because the symptoms are subtle. Take a case of Seema, 42 years old woman whom I met recently. She had persistent bloating and occasional pelvic discomfort. For 6 months, she was told it was gas, stress, maybe acidity by her family doctor. But it wasn't. It was ovarian cancer, diagnosed late. The story is not so uncommon that what you think. That's exactly why we need to talk about it. What is ovarian cancer? Before we dive into the symptoms, let's understand the disease itself. Ovarian cancer starts in the ovaries, a small organ responsible for releasing eggs and female hormones. The most common type, which is called is epithelial ovarian cancer. The challenge? Early stage ovarian cancer rarely causes obvious symptoms, which is why more than 70% of cases are detected at later stage. So recognizing the symptoms is very important. So what are the signs that some things may not be right? Understand it properly. When there are certain signs, you should consult, you should pay attention, especially if persistent for more than 2 weeks. Bloating that doesn't go away, pelvic or abdominal pain, feeling full very quickly after eating, frequent and urgent urination, constipation or indigestion, unexplained fatigue or weight loss, lower back pain. So these are the symptoms which can be mistaken for gastrointestinal or urinary issues, which is why tracking their persistence is the key. Why it get overlooked? Now you might be wondering, why don't we catch it earlier? The challenge with ovarian cancer is that the symptoms are vague. They are easy to miss or misinterpret. They often overlap with other common conditions. That's why women experience such as irritable bowel syndrome, which cause bloating, gas, irregular bowel movements, PCOS, that is polycystic ovarian syndrome, which may lead to pelvic discomfort, irregular periods and hormonal changes. Even something as simple as stress can affect digestion, appetite and sleep. So when a woman feels bloated or has pelvic pain, it's natural to assume it's related to these conditions, not cancer. And what makes it harder is what we don't have a reliable screening test for ovarian cancer in general population. Unlike breast cancer, when we use mammogram, for cervical cancers we do have pap smear testing. There is no routine screening test available for ovarian cancer. So when you should see a specialist doctor? If you are over age of 40 years and you are experiencing symptoms like persistent bloating, pelvic discomfort, unusual change in your appetite or bathroom habits, please don't ignore them. Even if they seem minor, even if you have told it's nothing, if these symptoms are lasting more than 2 to 3 weeks, it's time to speak to a specialist. Now, if you have family history of ovarian or breast cancer, especially if a mother, sister, aunt or grandmother were diagnosed before the age of 50 years, this could mean this is a hereditary risk involved. In such cases, we strongly recommend genetic counseling and testing particularly for BRCA1 and 2 mutation. These are inherited gene mutations that significantly increase your lifetime risk of developing both ovarian and breast cancer and sometimes uterine cancer also. So understanding this risk early help us guide you better, whether it is about close surveillance, lifestyle changes, or even preventive strategies like risk reducing surgery after childbearing is complete. So knowledge is truly a power, and in many cases it's also prevention.